Okay. Just checking. Just checking. What? I put it on. You think? Oh, fine. Fine. Okay, clip it. All right. Test, test, test. Yeah, okay. Works? Okay. All
Oh,
right.
is it off mute, by the way? Make sure.
I turned it on.
The funny part was, I live 2 blocks from a second.
This is on mute. So this is good. Yeah.
Oh, yeah, sure.
Okay. All works.
My mother would let me go down and look at it. 2 blocks away, so that was very good.
Hello. Good afternoon. It is nice to see you all here. My name is Helen. I'm a registered professional nurse with about 30 years of experience. Come closer if you need to. There's plenty of space. Hello. So I am here today to give you some information, facts, something to think about, hopefully, about falls. I am also an owner of Izabella Home Care right here in town. So if you have any questions about home care services or anything related to home care, by all means, grab a brochure, grab our marketing materials, you know, the sanitizer, pens, and stay after or give us a call and we'll answer it. All right, now on to falls. So some of the numbers and statistics. Approximately 1 in 4 adults over the age of 65 fall every year. And we're talking about generally falls. Less than half of those tell their doctors. The numbers I have are not the most recent ones. That's the ones that were available by CDC. In 2021, 38,000 deaths occurred as a result of the fall. More than half of falls occur at home. Every year, approximately 3 million ER visits are due to the elderly falls. 319,000 older adults are hospitalized each year for hip fractures. So as you can see, falls are pretty serious. Now, the reasons why people fall, especially people over 65, lower body weakness in general, vitamin D deficiency, which in turn causes osteoporosis, which in turn causes weakness, difficulty with walking for whatever reason, and balance. Some medications put you at risk because if you're taking sedatives, if you're taking antidepressants, if you're taking tranquilizers, those of you who do take it or take care of someone who does probably notice that the person after taking that medication and sleeping, when they wake up, they are wobbly, they're not steady on their feet. It's a side effect of the medication. Vision problems, foot pain, poorly fitted footwear, and of course various hazards in the home, such as broken steps, throw rugs that go on top of the carpet that create a tripping hazard, electrical cords that people don't see, pets. Speaking of the pets, you have a question, sir?
Well, I mean by difficulty with walking,
Yes.
how does that happen? Like if people have Alzheimer's disease, are they more prone to fall?
Yes, but not specifically because they have difficulty with walking. If everybody heard the question, are people with Alzheimer's are more prone to falls? Yes. But it's not necessarily because of their physical constraints, more so than their mental acuity. So people with Alzheimer's they have quite often poor judgment. So they may see the step, they may not realize that the step is too high for them to step on.
One question, like, if they still have their sight, you know, how could they not see the step if they still have if they still have vision? If they have glaucoma?
They see the step.
So why are they more prone to fall all the time? Does that have something to do with the structure of the body?
No, it has something to do with when you see the step, you may realize the step is too high for you to climb on, or you can see that it's uneven and realize that it may be a hazard or falling issue. People with Alzheimer's, even though they physically see it, do not have the judgment to understand that yes, there is a step, however, that step is also uneven and I may fall. That's where the danger comes in.
Because the bones are breaking down, the body's breaking down.
Yes, but not because of the Alzheimer's. Alzheimer's doesn't have much to do with the bone. It has more to do with mental acuity. Now, speaking of the pets, I'm sure that at least some of you love pets, love cats, love dogs, and it is wonderful. I am one of them. I love pets. I have cats. The first thing I asked my husband to do when we moved closer to here, the stairway from the first floor to the second floor had the railing only on one side. I have a cat. What do cats like to do? They like to go under your feet when you're walking. And the first thing I noticed, and I am not there yet in terms of being over 65, so I told my husband, we need railing on the other side so I can grab whichever side, because guess what my cat does? He loves to go from one side of the step to the other, right under my feet. What's going to happen if I don't have the railing to hold on to? I'm going to fall. So that is very realistic concern. I'm sure for all people, but specifically for
Also,
elderly.
people who have Alzheimer's disease, when they walk down the steps, they may not see the banister, right?
They would see the banister, but
Unless
again,
they have vision problems.
no, it's not a vision per se, but it is an issue, again, for them to use their judgment to hold on to the banister. It's not so much with the physical issue of vision or walking. It's more of their capacity to see where the danger can come from. Poor judgment. Now, spills is another big concern because, again, I'm sure most of you, if not all of you, at some point during the day cook at home. You cook in the kitchen, you're carrying something to fill up the cooking pot with water. You lost a little bit of a balance, or the strength in your arm isn't that great, you spill the water. What you need to keep in mind, or for those of you who have someone to take care of at home, that spill needs to be wiped right away, because you're going to forget, you're going to step on it, regardless of what your shoes are. If your shoes are well fit, poorly, you're going to slip. If you slip, you're going to fall, and the risk of the fall is you can hit your head, you can break your hip, you can break something else. So that is another big concern. Electrical cords nowadays probably is not that much of a concern unless, again, you have a whole bunch of electronic equipment and you have the equipment on one side of the room with the cord going through the entire room where you walk, where it's in your path. So that's another concern. Now, consequences of falls. What can happen if you do fall? Like I said, you can fall and break bones. The problem, anybody can fall and break a bone, right? A child can fall and break a bone. However, when you are over a certain age or of a certain age, the bones have difficult time healing. They are more porous. You lose calcium as you get older. You develop osteoporosis. So your bones are more brittle and much more difficult to heal. So that is a concern for any kind of fracture, whether it's a wrist fracture, an arm, an ankle, a hip. Hips are the most difficult because first and foremost, you would probably, I would say 100% need a surgery to fix it, because as opposed to other fractures, that one won't heal on its own. You would need a surgery to fix it. The hip bone, depending on where that fracture happened, whether it's ahead of that hip bone, and it usually breaks right there where it attaches to the pelvis, or if it's the hip bone itself, which is a long bone that goes from the hip to the knee, the surgery is, I wouldn't say it's complicated, but it's a surgery. It's a surgery with general anesthesia, with the risk of going under general anesthesia and all of that. After that kind of surgery, anyone, again, regardless of the age, will need some sort of rehabilitation. And depending on how you do or how the patient does with rehabilitation, there is a question now whether or not that person can actually go back home. Because, as you all are aware, most houses have some sort of stair, either to enter into the house or to go from the first floor to the second floor where the bathrooms are in most homes. So that is the issue in many situations when people end up in hospital after a broken hip. Then they go to rehab for rehabilitation. And now the question that all physical therapists will ask you, do you have steps at home? If you have steps at home, the program, the rehabilitation program that you will get will definitely include some stair climbing. Depending on how the person does with the stair climbing, they may or may not be considered safe discharge home, especially if that person lives alone. Not to mention that, God forbid, the person cannot now climb stairs, and the bathroom is upstairs. How are they going to shower? So that's where the problem with the hip fractures or foot or ankle fractures. Now, another big concern is a head injury, because when you fall, you may or may not hit your head. The head injury may cause a bleed inside the brain, which is pretty much what stroke is. And depending on the extent of that bleed, there's a whole bunch of concerns. Person may go into a coma, never to wake up from it. The person can develop, as a result of that kind of a stroke, weakness on one side, which is another problem. A person can die just from hitting the head. It is especially concerning for people who are also taking blood thinners, because the blood is less likely to clot as is when you're on blood thinners, and now you add the injury to it, so there is the chance of the bleeding inside the brain is higher, and that bleeding is more likely to be more massive than the person not on blood thinners. Another opposite side, I would say, of the scale, even if the person doesn't break anything, even if you fall and got help, you didn't break anything, you just got a bruise or a swollen ankle, and then it goes down. The problem is that it's now in your head that you have fallen, so you're afraid to move. You're afraid to move more. And that also causes the people who do not move enough to get weaker, which in turn may cause falling. So there is a whole slew of things that can happen. Now, what can you do? Well, first and foremost, you have, or your loved one, or yourself, talk to the doctor to evaluate you for the risk of falls. Talk to the doctor about evaluating your medications. and see if they have potential to make you dizzy or sleepy and fall. Sure.
How does your doctor check your vitamin D?
The doctor takes a blood test. There are several ways, but there is a blood test for vitamin D. There is also a bone scan that doctors quite often recommend for people of certain age, just to check how your bones are, if they are strong enough, if they became too porous. It can't really change much, because if your bones are brittle, they're brittle. But the doctors do prescribe supplements like calcium supplement, like vitamin D supplement. In certain, the vitamin D supplement has to be prescribed in a prescription strength. It's not the same as you go to drugstore and just buy vitamin D. It's different. The one that doctor prescribes is more potent than the one that you would buy over the counter.
Do you have a guarantee that if you eat enough foods of vitamin D, your bones will...
You can definitely improve your
Does that give you
vitamin D.
Does that give you a guarantee?
Not at all.
No guarantee.
Vitamin D deficiency is developed not just because you don't get enough of vitamin D, or calcium for that matter. It's developed because your body doesn't absorb vitamin D or calcium in enough amounts as you age.
So if you eat the healthiest foods, you could still have osteoporosis.
You can,
So
unfortunately.
it's not guaranteed that if you eat the right food.
It's not a guarantee.
Okay.
No, it's not 100% guarantee for sure. Having healthy diet definitely helps, but it's not a guarantee that you're not going to develop osteoporosis or it's not going to get worse. So, unfortunately. Now, other things, what you can do outside of the home versus at the home. You can get screened for osteoporosis. As gentleman mentioned, get a doctor to test. Doctors usually do it on their own. You don't need to tell them. Sometimes you may remind them to check your level of vitamin D or to send you for a bone scan. Now, exercise programs are extremely important in maintaining balance, strength, as well as the bone health. Because when you work on your muscles, it also increases your bone strength. So any kind of exercise, walking, Tai Chi, Pilates, dancing, anything that will make your heart beat faster and also develop some sort of the strength. Many people, especially of certain age, do not realize the potential benefit of strength exercises. It is very important. So if you can work with some weights, some strengthening exercises, dumbbells, it doesn't have to be a 50-pound dumbbell, it could be 5 pound if you can. If you can't, if you are good with 5, you can increase to 7.5. If you can do 7.5, you increase to 10. Whatever you can do to work on your muscle tone, that will also help you with balance, prevent you from falling, make your bones stronger. So all of those things are important. Diet, yes, but exercise, definitely. Now, of course, the eye health is very important because, again, if you don't see the step, you're gonna trip and fall. Or if you don't see the spill, if you don't see the cord. So check your eyes. Unfortunately, and I am very well aware of that, at the time when you get to be needing more of the eye health and checkups, Medicare doesn't cover it. So you would have to either buy a vision plan or pay out of pocket. But those vision exams, Medicare does cover if you need specific treatment for like glaucoma or cataracts, but for the regular routine checkups, they don't. not Medicare, not supplemental. There are some, from what I know, Medicare Advantage plans that do include some vision benefits, but not a whole lot. So at least once a year, if you don't have any history, get yourself to an ophthalmologist or optometrist. Optometrists basically, as far as the exam goes, do the same thing. They just don't do surgeries as opposed to ophthalmologists, but they can do the vision check. They can give you a prescription for glasses. So get that checked and make sure that you have glasses. Sure.
Yeah, I have VSP,
Uh-huh.
because they did cover the glasses and
Uh-huh.
some of the exam. So the glasses ended up costing me like, because I have bifocal progressions, I can't see too well, and
Complicated.
so they ended up, it's like $25 a month for the
Mhm.
VSP.
Right,
And the glasses ended up, it ended up being a savings for me at the end.
right,
When you calculate the glasses are $600.
right.
So I don't know if anybody else has any plans.
Right. It really does depend on the situation.
I got it through AARP.
Right. And everybody can go and check. If you guys have questions, I'll be more than happy to help you. But you would have to weigh pros and cons, whether it makes sense for you to buy the vision coverage or doesn't. If it's in your case because you have issues and complicated prescription and they definitely would cost you more than what you pay for the insurance, yeah, it makes sense, of course. Now, if you do, by the way, have progressive or bifocal glasses and you need both distance and reading, it is better to have two different pairs than to have one. The eye takes time to adjust from one part of the lens to the other. So if you have, say, the top part of your glasses are for distance, but the lower part is for reading, and you are out walking, you may not change to the right side, to the right part of it fast enough to see something in the distance. So it is better to have two pairs, one for distance and one for near reading. Now, those are the things that you can do outside of the home. Now, inside the home, get rid of the clutter, because that's another part of the issue why people fall. Because they got a package, they put the package on the floor, they forgot that the package is there, and then they walk with something in their hands without seeing that package. They trip and fall. Now, the grab bars are very important for preventing the falls in the bathroom. Because another place where people quite often fall is the bathroom. Why? It's slippery. You soap, you wash, there is water and soap under your feet. There are special slip prevention rubber rugs that you can put inside the tub and outside the tub as well, sure.
When I take a bath at home, even if I have grab bars, I could still get out of the bathtub, not bare feet, I could still wear sandals.
Yeah, no, definitely.
Or socks.
But it helps to have the grab bars, because when you need to step over the tub, you're standing on one foot.
Yeah.
So to keep the balance, you need something to hold on to.
But you should also keep a phone in the bathroom in case you have to call police.
Absolutely, that is
Emergency.
a very good
Suppose you
idea.
get a heart attack, or say
God
you get a
forbid.
stroke.
Right,
I mean,
right.
so many things can happen to you.
So,
that
absolutely, when you're in the bathroom. Another situation where people
If you don't have life alert.
yes, life alert is a good thing, but what people also don't always realize, sometimes when people use the bathroom to move their bowel, they get dizzy from straining.
Oh, that's no good.
It's no good.
You
So
can get a hernia.
that's another problem where people can get dizzy and fall. Either that, or when they sit for a little while and then they get up fast they get dizzy and lose their balance. That's another problem that people may not realize they have. So bathroom safety is important. Now stairs, as I mentioned, it is very wise to put the railing on both sides of the stairs, because depending on whether you're right-handed, left-handed, if you're going up or you're going down, it's nice to have something to hold on to on both sides. And, of course, ensure that your house has enough lighting. That is another thing that I catch myself lately. I don't turn the light on, especially at night if I get up, because I don't want it to wake me up completely. And so if it's the night situation, install the night lights that are activated by the motion. So
Well, you
at
keep
least
the light up. Well, if you're sleeping in the bedroom, you can keep your lights up, but you can keep the light on in the kitchen.
that's right. That's
Safe
right.
as
So
well.
in it somewhere nearby, or just install those night lights
Yes.
that are activated when you move. So if you got up, the light goes on. You go down and do not move, the light goes off and it doesn't bother you, and you can fall back asleep. Now, these are, so you were asking me how would the doctor know if you're at risk for falls. Besides the routine test for vitamin D, levels, for bone scan, for bone density scan. These are the questionnaires that are quite often utilized by nurses, by doctors, by physical therapists to assess for the risk of falls. I have fallen in the last year, yes or no? I use or was advised to use a cane or a walker to get around, yes or no? I'm worried about falling, yes or no? Sometimes I feel unsteady when I'm walking. I take medicine that makes me lightheaded. I need to push with both my hands to stand up from the chair. I steady myself on the furniture. That is another way people adjust for loss of steadiness and balance without realizing it. So if you ask someone, do you use a cane or a walker when you walk? They say no. Then you ask them to get up and you see the person pushing with two hands from the chair, holding on to all pieces of furniture on the way, but they're not using a cane or a walker. What they are using is not really that safe, because that piece of furniture they're holding on to, it can move. And that's another issue which also predisposes people for falling.
Also, it's dangerous in the house to walk barefoot too.
That is a problem altogether, not just because of falling, but also, especially if you're diabetic, or if you have circulatory problems, if you have poor circulation in your feet, and you walk barefoot, very high chance of you hurting your foot, hurting the bottom of your foot, developing a wound that won't heal, developing an infection. So barefoot, not a good idea. I have trouble stepping up and off the curb. That's another question. I often have to rush to the toilet. People who have what is called an urge incontinence. In other words, they're not incontinent, but they need to get to the bathroom as soon as they feel the urge, so they're rushing. Men with enlarged prostate is a good example. Sometimes they have a need and they have to go right away. They cannot hold. People who lost sensation in their feet, you're diabetics with diabetic neuropathy. So they don't always, they put the foot down, but they don't feel the surface underneath. They have numbness. If the answer is yes to any of the questions above, you're at a fall risk. Now, ages,
I wanted to mention, I live in a senior building, and I have a mini stroke, I have a walker, and I use it.
right.
And there's a lot of people in there that refuse to use anything, and they end up falling. and they'll be going to get the mail and holding on to everything and the tables and everything. And they're like, oh, I don't want one like you have. I said,
Right.
oh, okay.
Right.
And they said, oh, I don't want one. So I said, okay.
Right.
I said, they go, you have one. I said, I have one because I know that I'm off balance from a mini stroke and I need to use it.
Right.
And I'm gonna do what's best for me.
Yeah.
But a lot of people don't use it and they do fall.
Yes. Yes. And it is very unfortunate because not all falls can be prevented, but many can if people would just think about their safety rather than about decorum. I understand people don't want to admit that they need help. I get it. It's maddening.
Mhm.
But would you rather hold on to a cane or a walker or end up in a nursing home? I mean, these are the two sides. There's nothing in between. You broke your hip, you can't climb stairs, you end up in a nursing home. You know, if you have to make a decision whether you're going to walk and people will see you with the cane or a walker, or no, you look like you can walk, but you can't. So the high-risk groups, as we have established in our last, those of you who attended my last presentation in Alzheimer's, why women are at a higher risk for Alzheimer's than men? We live longer. And your risk of Alzheimer's increases with age. Same goes for falls, because women tend to live longer. They are at a higher risk for falls because the risk for falls also increases with age. Chronic conditions, as we mentioned, osteoarthritis, osteoporosis, history of a stroke, one-sided weakness, TBI, which is traumatic brain injury, whether it was caused by a stroke or something else. Diabetes. Why? Again, diabetes diabetes ruins your blood vessels, including the ones in your feet. Therefore, you have numbness in your feet. It also ruins your blood vessels in your eyes, so your vision gets worse. That's why people with diabetes are more prone to falls. Balance disorder. Sometimes people have vertigo, not because they take medications, not because they had a stroke, just because they're dizzy. There are changes that happen as you age in the brain that can cause just dizziness.
Well, sometimes, one time I was on a train when I went to Queens, this was something had nothing to do with diabetes. Sometimes you could fall if you're nervous, if you're thinking about unpleasant things at night, and after 3 or 4 minutes that cleared up and it was all right. That's not the same thing.
No.
That's because of nerves. I was thinking about, if anybody could fall and get dizzy if they become very nervous and stressed out.
Very true.
That's entirely different.
Very true. If you are nervous, but especially because people who have fallen already or had near fall incident, they're scared. And if you're scared, you tense up. You don't watch your balance. And that's what makes you more prone to falling. You're right.
But that cleared up in 3 or 4 minutes and was all right with that.
Good.
That could happen to anybody.
So if you feel dizzy
Nervous,
when you are
nervous.
walking, say, down the stairs, stop.
Yeah.
Just stop.
Sit.
Hold on to, if you can sit, sit. Hold on to the railing. Wait for that moment to pass. As you said, in a couple of minutes, it may pass.
And they say you're not supposed to walk too much in the heat because you get a heat stroke.
That is for sure. Yes, definitely. Weather has definitely an impact. Cognitive impairments such as Alzheimer's and dementia, again, not because of physical ailment, but because the judgment is off. So people don't realize what may or may not be dangerous. So those are the risk factors.
How about if you have high blood pressure? That could cause you to fall too, right?
If you have high blood pressure, it in itself can cause you to get dizzy. However, if you take medication for high blood pressure, that can also cause you to be dizzy because it lowers your blood pressure.
Even your diet, if you eat too much salt, sugar, salt, fat, and if you're overweight and you smoke, also.
Shortness of breath, of course, yes. Now, falls may not be a priority for the patients themselves, and here is why. Some people believe that falling is a normal part of aging. Some people are afraid to report their falls because they're afraid to lose their independence. So if the person is elderly, living alone, and gets a call from the daughter, "Ma, how are you?" "Oh, I'm fine." And then the daughter visits and sees a huge bruise on the arm. "What happened?" "Oh, nothing, I just hit my arm." "What happened, Ma?" "Okay, I fell." "When'd you fall?" 3 days ago." So nothing's broken. There is a bruise. Do you think that mom went to the doctor and reported it? I bet you she did not. She wouldn't have even told the daughter unless somebody saw it. So.
Also, one other thing, some people fall and it's their own fault because they went for a bus and they crossed dangerous streets and they don't look to see the cars. That you can control. That
Right.
doesn't come from
Right.
the invasion.
There are some things you can control, and there are some things that, unfortunately, you cannot. But you should be aware, at least of those things you can control, and control them. Again, being unaware of common fall risk factors. So, if you are going to the pharmacy, I'm pretty sure that the pharmacist, if they haven't talked to you in person, they gave you this long paper attached to your prescription telling you this medication can cause dizziness. Careful driving, operating machinery, right? Doctors, probably not so much. I mean, they can mention to you that the medication they're prescribing will or may cause dizziness, or it's a common side effect. To be honest, if you look at the side effects of a whole bunch of medications, they all have dizziness listed. Do they often cause it? No. But there are some known to cause dizziness. The doctors, why they're not addressing the issue? They don't have time because your visit with them has a limited amount of time. They may or may not be aware of the whole fall prevention situation, because if it's a primary care provider, they may be aware. If it's a specialist, probably not, unless it has to do with their specialty. If you go to different doctors, they do not always communicate with one another or do not always coordinate the services or the treatments that you get. So that's another one. And guess what? Money, right? There is no reimbursement in fall prevention. There is reimbursement for fixing a broken hip, but not for fall prevention, strangely enough. Now, some other consequences. 95% of hip fractures are due to falls in older adults. Falls are also leading cause of traumatic brain injury. And as I said, falls and injuries increase the risk of nursing home placement, because traumatic brain injury followed by one-sided weakness, inability to walk up and down the steps, inability to get dressed by yourself, inability to feed yourself, inability to wash yourself, so nursing home placement. Now, falls are also very costly. The average hospitalization, and this is an average, due to fall injury, and that number probably does not include hip fractures because it will be a lot higher, $30,000. Emergency visit for fall injury, average $4,000. Office-based outpatient visits related to fall injury, average over $5,000. Again, my numbers are from 2018 because CDC doesn't provide information most updated. Medicare costs for treatment for falls in older adults in 2018, $29 billion. Medicaid costs, $9 billion. Private out-of-pocket costs, $12 billion. Because sometimes there are costs that Medicare doesn't cover, As you know, Medicare only covers 80% of the bills. And the other 20% come to either private pay patients or supplemental insurance or Medicaid. Now, the success rate of screening and prevention, of fall screening and prevention. I did some research to see if there was any data related to positive outcomes for the fall prevention. There is. United Health Service Hospital, which is a system that includes hospitals in New York, 79% of their patients were screened, and those who did have some sort of a fall prevention plan were 40% less likely to have a fall-related hospitalization compared to those who are at risk with no plan. So it helps. It may not help 100%, but it helps. And that basically concludes my presentation. Any other questions, concerns, comments? Anyone?
You mentioned balance.
Yes.
What is the treatment for balance issue, vertigo?
Exercise. There are exercise, for example, Tai Chi.
Okay.
Any exercise, there are plenty of exercises that will improve your balance. Any strengthening exercises, because even when you lose your balance, if you're strong enough, you can correct yourself. But if you're weak, you can't.
Some people have conditions called ataxia. That means that destroys your breathing, and that could cause you not to walk at all. And people have problems. People can't walk for many reasons. If you have arthritis, you could walk, but there's such a thing as called ataxia.
Ataxia? Ataxic gait, you mean, when a person is off balance, period.
They say that does not get better.
That is what?
That does not get better.
It does not.
It's
And
worse than that.
it does not.
So how do you avoid getting that? You have to eat the proper foods, salt, sugar, starch. How do you avoid?
If you have ataxic gait is an off-balance posture when you can't correct it.
How could you avoid it?
Falling?
No, avoid getting it to begin with.
You can't. It's associated with certain medications, diseases, and diagnoses when people develop ataxic gait. Sometimes it's a result of a stroke.
Yes.
Sometimes it's a result of other conditions that are neurological in nature. Can you fix it? No. But you can still put in place some sort of precautions so that person, when they do walk, that they don't fall.
So eating the right food is not going to prevent that?
No, unfortunately not. There are some things that can be prevented with keeping the right diet, and there are some things that cannot, where diet doesn't really have an impact. Yeah. And there are also physical therapy exercises and programs for people with ataxic gait that would help them to get better. It's not going to get rid of it, but it would help them to get a better balance. So, any other questions?
I have a question.
Of course.
Only because I'm noticing that sometimes with our elder generation, you're a little bit more skeptical about using
They are.
wearable devices, so the Apple Watches or the hearing aids that
Uh-huh,
have fall
yep.
prevention
Yep.
built in.
Yep.
Which are great tools.
Yes.
But I've seen something more recently, and they don't like Alexa, they don't want Google, they're like very concerned about privacy.
Mm-hmm.
But I saw some device for them, I can't remember the name of it. It's probably pretty expensive because of how it's more proactive. so you can build in, instead of you voice commanding the
Mhm.
device, you know, call my daughter, I just fell, or call 911, I just fell.
Mhm.
Then it will sort of ask you, and then you as the caregiver or the distant, like, relative can program it to say, remind mom to turn on Wheel of Fortune at 7 or something like that. So it's more like this will actually prompt the elder to
I
take
have
action.
to, I get it. I have to
Yeah.
know a little bit more about that particular device.
Okay.
There are devices that can, like, such as Life Alert.
Yeah.
There are also devices that are quite often, well, they're not anymore. They used to be utilized in the nursing homes. They're called fall bells. So the person has to wear something on them that will prompt the staff if that person who is, for example, at risk for falls got
Right.
up.
Yeah, oh yeah. the
But
max,
that
yeah.
is,
That's-
as I've learned
Yeah.
recently, that has been banned in the nursing homes,
Mm.
which makes no sense to
That
me,
makes no sense.
because they will fall, and they
Yeah.
do fall.
And I used to work somewhere where we could actually order those for home use too.
Right, right.
So-
That is something that can be used, but that only makes sense if there is someone else in the
To-
home.
Yeah.
Because if the
like,
person
live
lives
here.
alone, what's the point of me being 30 miles away knowing that my dad got up from bed? What am I going to do?
What are you gonna do?
Drive 30
Yeah.
miles to find out if he fell? I mean, I can call him to find out if he is okay, but he's also hard of hearing.
Yeah.
And he does not wear a hearing aid. He refuses. He claims that he hears well.
Right,
And,
Right. yeah.
you know, they say on a joking side, the biggest reason for elderly people falling is them thinking that they're not old, that they're still young and can do it all.
Also,
Uh-huh.
the cost of the hearing aids. The
That
cost
is
of
true.
the hearing aids.
That is very true.
I know, I need them, and they're very expensive. even
They
the
are
cost
very
of-
expensive. I
Yeah.
agree
And I know other ladies
100%.
in the building with me that can't hear too well. And
Right.
they said, you see how much they cost? I said, yeah.
Yes,
The
yes.
cost is-
And again,
they don't cover it.
Medicare doesn't cover it.
Medicare doesn't cover it.
It doesn't cover eyes, it doesn't cover ears, it doesn't cover anything bathroom related. We used to have this expression in home care where I used to work. Medicare doesn't go to the bathroom. Medicare doesn't cover grab bars. It doesn't cover shower chair. It may cover if you already had fallen and have a broken hip. It may cover the 3-in-1. It could be used as a bedside commode and as a raised toilet seat. But only if you already fell and broken your hip. Other than that, it won't cover. So,
They don't cover rollators either.
they do.
Oh, do they? Okay.
They do.
Okay.
Medicare does cover it. The doctor would have to fill out a
Oh,
form
okay, I bought it myself.
that,
That's
yes,
fine.
they
Yeah.
do cover rollators, walkers,
Okay,
canes.
okay.
That they do. That they do. The bathroom equipment, they do not.
Oh, they do not.
And neither will they cover any incontinence supplies, which is another like, when do you need diapers? When you're 2 months old and when you're 92 years old.
Mhm.
But they won't cover it. So, any other questions? And by the way, speaking of the canes and the walkers, it's not as simple as it seems for you to just go and get one at the pharmacy or a supply store. It has to be fitted properly, and you have to get physical therapists to show you how to use it safely. Because
Yeah, I
Walkerette, for example, has brakes.
Yeah.
You need to know how to put them on,
Yeah,
right?
Yeah, I
Especially if
think
you
so.
decide to use it as a chair and sit on it,
yeah.
you have to make sure that the brakes are on.
Yeah, I had physical therapy because I couldn't
Right.
walk or put my leg up.
Right,
And they actually sized it for me.
exactly.
I
It
had-
has,
I had
and,
one of my neighbors put it together for me, and they said, oh, no, it's not the right height.
right.
actually
It
fixed
has
it
to
for
be
me.
the right height. You have to know how to use it safely.
Yeah, we
Sometimes I
yeah.
see people, and I'm sure you see them in your building, they go around with the shopping cart, using it instead of a walker.
Yeah, yeah. They tell me that, you can use a cart. I'm like, no, I can't use a cart, I'm balanced. How am I gonna?
Right.
What's the cart gonna do? I'm gonna fall
And
over
guess
with the
what?
cart.
They fall.
They fell, and I'm like,
They fall because the shopping cart doesn't roll the same way.
no.
You still have you still have to have vision and sharp mind in terms of judgment to understand that the ground, the pavement that you walk on, it's not even.
Right.
So if you go with the shopping cart, especially fast,
Mhm.
you're bound to trip over it when the cart hits something like uneven surface. So I've seen those a lot.
Like when I go shopping, I have one bag on the seat
Right,
and one bag here.
right.
So I actually have two bags. And then I've seen people trying to push a cart with a walker too.
Yeah,
And I'm like, you can't push a cart with a walker. I've tried it. No.
Before you guys leave, please help yourself with some refreshments. They're fresh. Any other questions or concerns?